As part of today's briefing, we'll be providing an update on the next phase of our immunization plan as we prepare for the fall. People in BC have demonstrated a true commitment to protecting themselves, their loved ones, and community throughout the pandemic by observing public health measures and getting vaccinated in record numbers. It's important to recall that 94% of British Columbians, 94%, have received their first dose immunization from COVID-19. And every time, I want to acknowledge and thank every British Columbian who, when they've been invited to get vaccinated, have got vaccinated and protected themselves and their community. These efforts have saved lives. Not a few lives, not 10 lives, but thousands of lives. And of course, around the world, vaccination has saved many, many more than that. Our number one priority is, was, and will be protecting people, especially those at the highest risk of severe illness or death. That is why BC has followed advice from public health since day one and has implemented measures to protect those living in long-term care, elderly populations, and those who are clinically extremely vulnerable, ensured that these groups of people were and are prioritized for vaccination. Equally as important is protecting our healthcare system capacity. This means ensuring our healthcare workers receive priority access to vaccines to protect themselves and those they provide care for, and reducing pressure on our healthcare system through a robust vaccination program and appropriate public health measures based on the best available evidence.
So I'll repeat that our first priority is and continues to be to protect people, and especially those at highest risk of severe illness. Since the beginning of this pandemic, public health, we've been keeping our eyes on a number of key factors. And these factors were actually helping us, guiding us in terms of all the recommendations that were made, and also to guide our actions, all the actions that we took to actually manage this pandemic. So these various factors include, among many, a number of things. So initially, if you remember, we were looking at the interval between the first two doses. We also are continue to be looking at those new variants of concerns that keep popping up and their transmissibility, how infectious they are. We also look at all the different types of vaccines that we have available for COVID-19. We look at outbreaks, we look at cases, infections, breakthrough infections. We also look obviously at what happens in the rest of this country, but also around the world. It's a global pandemic. We look at case rates, the number of cases, how that evolves, and we also look at what happens with hospitalizations. So this work has and continues to be very important, and we will continue to keep our eyes on all these things, and we will continue to adapt as the pandemic is evolving. So as you can see partly here on this graph, the number of deaths and the number of hospitalizations have decreased significantly a number of times, and even more recently. And so we can see that here. And they have dropped significantly from those peaks that we see to much lower levels. Vaccination has made a huge difference to be able to get us there and drop the number of cases, hospitalizations, and deaths. So we need to continue on that trend. We're in a much better position now, and it means that we need to be all up to date with all the doses that are recommended in our particular situations. Unfortunately, we know that there's also about 1.3 million people who have not yet received their booster dose. So being fully immunized with all the doses that are recommended is very important, because we know that it makes a huge difference, provides excellent protection, and it makes a big difference in terms of what we see month over month. So over the last few weeks, as you may have heard, we have seen an increase in the number of cases being hospitalized. So we are keeping our eyes on that. The virus continues to circulate, so we want to be clear, the pandemic is not over, unfortunately, and we are seeing the number of cases and number of people ending up in hospital go up and down, and we will continue to see that. And that is expected.